Good morning, everyone. I'm just going to give it a couple of minutes to let people have a chance to join us before we get started. Okay, well, numbers are still rocketing up in terms of people joining, but we've got a packed agenda, so I'm gonna get us started now. And as people are joining, good to see everyone saying good morning in the chat. What is hopefully a sunny morning across the country and wherever people are joining us from. My name's Sophie Bubis. I'm the Head of Policy and Research at Homeless Link, and I'm delighted to be here with you this morning to chair this event and what promises to be a really interesting, insightful, reflective, and hopefully really positive event launching the Census 2023 report authored by Change Grow Live's research team. Before we get started, and we have a really packed agenda with some great panelists here to talk to you about their experiences of doing the census, as well as the findings from the report itself. I was very aptly reading a blog that the Centre for Homelessness Impact published just last week, which was looking at how to develop inclusive methods for counting homelessness and why it's so important. And it included a sentence that really resonated with me and has sort of really struck me and has been sort of spinning around in my mind since I sort of read it, which was, people are not invisible and they are not hiding. We are choosing not to see them. And I think that's so sort of apt, so true, and sort of so meaningful to kind of such a long sort of storied history of understanding how we know who's experiencing homelessness and rough sleeping, and how we capture the numbers of people experiencing homelessness. And it's often seen as a bit of an impossible task to sort of truly understand who is experiencing homelessness. You know, people are hidden, people aren't known to mainstream services, they're reliant on informal networks of support. But what we also know is that a lot of those sort of assumptions are based on sort of measures, or sort of are about how, well, what we know is that those assumptions are based on kind of historic assumptions about what we expect to see and what we've sort of built as a sort of understanding of how people experience homelessness. And if we've built our methods for capturing who has experienced homelessness based on assumptions about how homelessness is experienced, then that filters down to how we design our services and our pathways. And that's all based on who is seen through those counts. And if we don't know who's experiencing homelessness, we don't then provide the service and support that is needed. And that means we aren't, across the sector, providing the inclusive offer that is needed to end homelessness for everyone. But what we know, and what we're going to hear all about today, is that there are ways to consider and change to deliver more inclusive approaches to counting people sleeping rough. So before we get started with our panelists, I just want to give a little bit of background to the Women's Census and why we're here today, and what we're going to sort of hear about and sort of learn about. So since rough sleeping was defined for the purposes of counting, so a purpose of capturing the number of people experiencing street homelessness, a growing body of research, also the voices of women with lived experience of rough sleeping, and the experiences of frontline services have all sort of highlighted and pointed out that the fact that women are underrepresented in these figures. And the reasons for this vary, but the predominant reason is that women are rough sleeping in ways that means they are less likely to be seen bedded down or about to bed down than men who sleep rough. And we know that this is due to fear of violence and abuse, a very prominent sort of factor behind this. And this lack of visibility can also result in women who sleep rough being less able to access services and accommodation, particularly in those local authorities where people have to have been verified through those definitions as sleeping rough by outreach workers before they're able to access that support. The Women's Rough Sleeping Census was developed in 2022 in response to the problem of counting women rough sleeping and a need to better evidence the need for their support and the services. So a coalition of organisations and researchers that developed the methods drew on existing research the accounts of women with lived experience of rough sleeping, and the experience of frontline services, which created a methodology that we're going to hear all about in much more detail this morning, shaped around the experiences of women who are sleeping rough. The census was piloted in London. It grew again last year in 2023 and was delivered again in London and across 14 local authorities in England. And we're going to hear from some of those local authorities later on this morning. The census is a collaborative initiative, and there's been input from a range of services and practitioners into its design and development. It involves a central organising and design team, which includes Single Homelessness Project, Solace and London councils, but it can only take place with the generous involvement and support of outreach teams, statutory services, services for violence against women and girls services, health services, drug and alcohol teams, migrant support services, and many, many more. It's a truly partnership cross sector approach to understanding the number of women who are sleeping on our streets. So who are we going to hear from this morning? We're going to hear from DLUC, who are going to share some of their reflections on the reports and its findings. Then we're going to hear some highlights from the results. We're going to hear, as I mentioned, from some of the participating local authorities who are going to speak about their experience of delivering the census and why they decided to take part. And finally, Solace and SHP are going to summarise their recommendations from the report and the next steps for the census. We're going to hold a Q&A at the end for all of our speakers and panelists. So if you have any questions, if you can pop them in the Q&A chat as we go. So you remember them, don't forget them, and we'll be keeping a log of them and making sure that we're kind of capturing them for the Q&A at the end of the session. Before I hand over to our first speaker, I just want to thank all those who took part in and helped to design, coordinate and deliver the census. So some particular thanks going to Change, Grow, Live for producing the report that we're launching today, for the detailed analysis of the information that's coming out of the census, for Izzy Langdale for all her support in piloting the census nationally within her role at Homeless Link. For London councils for helping to fund and support this work, and all the local authorities who participated and delivered this the census this year. For Fidelity International, Arnold and Porter and Goldman Sachs for their generous support for this work, and most importantly, every woman who completed the census survey and who's contributed to the development of the census. So our first speaker I'm delighted to introduce is Isabella Connell, who's the Deputy Director at the Department of Levelling Up, Housing and Communities. And Isabella's going to talk about their reflections on the report and its findings. So I'm going to hand over now. Thank you.
Good morning, and thanks so much, Sophie, for that introduction. And I'd like to start by saying thank you to Solace's Women's Aid, to Single Homelessness Project, to London councils, and echo the thanks that you've given, Sophie, to everyone who's been involved and contributed to the project for all of the work that's gone in to delivering the Women's Rough Sleeping Census in 2023 and in 2022 as well. And it's been absolutely great from my perspective to see how the census has grown in its second year and see it enabling more vulnerable women to be supported. Within DLUC, the annual Rough Sleeping Snapshot has been our flagship data collection on rough sleeping since 2020. Now, obviously, no data collection is without its challenges, certainly not data collection on rough sleeping for some of the reasons we've talked about. But the annual snapshot has been hugely important. It's supported us to secure funding for rough sleeping services, and it's informed conversations across government with a truly cross-cutting rough sleeping strategy published back in 2022. More recently, we've rolled out the Ending Rough Sleeping indicators, which have enabled local and central government to measure progress towards that target of preventing rough sleeping, where it cannot be prevented, ensuring that rough sleeping is rare, brief and non-recurrent, a phrase that I'm sure will be increasingly familiar to lots of you on the call. However, we do know that the methodology adopted in our data collections may be less likely to capture sleeping patterns of women experiencing rough sleeping. And so we very much welcome the approach of the Women's Rough Sleeping Census to help reach more women sleeping rough and gain a richer understanding of women's housing need. A close partnership working, as Sophie touched on, between local support and agencies is so important. And in the Department for Levelling Up Housing and Communities, we've been working to support the transformation of local services and provide a person-centred approach for vulnerable people and those with multiple disadvantage. And that's through some really important programmes like the Rough Sleeping Initiative and the Changing Futures programme. And it's been great to see the Women's Rough Sleeping Census encourage that kind of partnership working too. We'll continue to encourage local authorities to look at the guidance and consider conducting a census in their area. One of the things that I think the census has really highlighted is that there are times when outreach teams may need to adopt a more flexible approach to ensure rough sleepers are being supported. And in March this year, I wrote to local housing authorities asking that where individuals have significant needs and without support would be likely to spend a prolonged period on the street, then those verification processes should not be a requirement for, or indeed a barrier to, providing accommodation and support. And that might also mean differentiating the offer for those with high needs from those with lower needs or in shorter term housing crisis, less likely to sleep rough long term. We've already seen positive changes in practice that local authorities have implemented following the introduction of the Women's Census. And in DLUC, we'll continue to share best practice, predominantly through our fantastic team of rough sleeping advisors. But just to give a couple of examples, and I know you'll hear more during the course of the morning as well. But for instance, the London Borough of Brent's outreach team now conduct a gender-informed outreach shift each month. And that differs from their normal outreach shift because it's done later in the day and they're specifically focusing on identifying women who are seen during the day but not necessarily seen bedded down. And the focus there is about engaging with vulnerable women rather than on the verification process. Or in Worthing as well, where local partners have started adopting case plans for their longer term clients. And crucially, these case plans are not dependent on whether a client is currently sleeping rough, but much more based on their level of support needs and the likelihood of them accessing support otherwise. So our rough sleeping advisors will always work with local authorities to enhance their understanding of their rough sleeping cohorts so that they and their partners can focus their energy and resources on those cases that are furthest from resolution. And we all know, I'm sure everyone on this call knows, this can be long and painstaking work and doesn't often or always get immediate results. We know there are many other examples out there, and we'd be really keen and happy to facilitate future spaces to bring local authorities together to support and share learning between one another. And I know my team did this last November at the DLUC Rough Sleeping Data Forum, and I understand areas found that really helpful, and we'd be very happy to do more of that. I know you're going to hear later this morning from local authorities who've participated in the census who'll be able to tell you more about their experiences. But I'd really encourage you to listen to those, but also to speak to your DLUC Rough Sleeping advisor if you're interested in taking part in 2024. And let's all look forward to seeing this continue to grow. So on that note, I'll hand back to Sophie.
Thank you very much, Isabella, and great to hear the sort of support from the department behind the Women's Census and the initiative. We're going to hear now from about the outline of the census and the findings of the report. So we're going to hear from Lucy Campbell, who's head of service transformation at Single Homelessness Project. Eleanor Greenhalgh, who's the Women's Rough Sleeping Policy Manager at Solace, and Sam Wright, Research Coordinator at Change, Grow, Live, who's going to talk us through the findings of the 2023 census. So I'll hand over to Lucy first.
Thank you very much, Sophie. As Sophie says, hi everyone, I'm Lucy Campbell. I work for the homelessness organisation Single Homeless Project based in London. I'm going to be talking to you now a bit about the Women's Rough Sleeping Census itself and the methodology. We're going to be talking a lot about data and numbers over the next hour or so, and obviously a huge part of the Women's Rough Sleeping Census is about gathering more accurate and more inclusive data on women's rough sleeping. But I think before we get into all of that, before we start talking about that data and those numbers, I just want to really pause and reflect on the fact that when we're talking about these 815 survey responses received across 41 local authorities, we're talking about 815 women, we're talking about 815 lives. What's really significant about the Women's Rough Sleeping Census methodology is that the methodology isn't just about kind of going out and counting women experiencing rough sleeping. It's really about going out and speaking to those women and asking them how and when and where they're experiencing rough sleeping, and asking them, giving them the opportunity to share their experiences in order to kind of shape and inform our understanding and our response. So in the short amount of time that we've got together today, we obviously don't have time to reflect all of those experiences back to you, but I just want to play now a short video of some of those women's experiences that they've been able to share with us through taking part in the 2023 census. So I'll hand over to them.
Women are not safe on the street. Women are easy targets for other homeless people and the general public.
Sleeping rough is the scariest part of my life.
As a female, I feel so vulnerable. Sometimes I feel so scared to sleep outside in case of anything would happen to me. I feel people look down at me most of the time.
I feel scared. I had to find place on the streets to hide. It's terrible on my mental health.
I could run around and travel on buses. As a female, you can just go to the corner of a road and sleep. It's not safe.
I hate feeling like I can't go home.
Because I'm transgender, I face mental, physical and emotional abuse. I actually never feel safe anywhere and I'm constantly on the move.
The first time I slept rough, I was approached by a number of men. Most recently, I was sleeping in a tent with a man who was coercive to me and attacked me.
I need somewhere I feel welcome. Somewhere I can sleep and get up in the morning, somewhere where people are not rude to me, somewhere I can use the bathroom freely without someone pressuring me to leave. Women need to feel safe, dry, and warm.
Even in emergency accommodation, I was unsafe. I got water poured on me from the kettle.
There should be somewhere women can go to present. You don't know who to go to until you get told. But then you're hidden homeless and not bedding down so people can't find you.
I feel like I'm not welcome where I'm sofa surfing. It's impacted my mental health. I've taken an overdose in the doctors before to try and get admitted to the hospital as I needed somewhere to stay.
I think a lot of girls choose random places to stay, and there are a lot of homeless women out there.
So as Sophie's already said, a huge thank you to every single one of those women who took part in the census survey across England. So I'm going to talk to you now about the Women's Rough Sleeping Census methodology. So how do we respond to the challenge of understanding and counting a problem which is so hidden and in some cases invisible? So to respond to the challenge of the fact that we know that women are far less likely than men to visibly bed down on the streets due to that constant risk of violence and abuse, We created guidance for areas doing the census, which directed outreach to look in the areas where women tell us they go to shelter and sleep. So thinking about libraries, hospital toilets, hospital waiting rooms, 24-hour cafes, establishments like that, and really asking outreach to go into those spaces and places where they wouldn't necessarily normally go. In response to the fact that we know that women are even less visible at night, so nights when street camps happen, nights when the majority of outreach teams are going out to find and support people sleeping rough, women are just going to be less visible at night because it is the most dangerous time for them. It's dark, there are less members of the public around, women are much more likely to be not sleeping at all at night, they tell us. So they'll be on the move, walking all night, or exchanging sex or drugs or money for a temporary shelter, a roof over their head in a crack house or a stranger's flat or a hotel room, etc. How we respond to that kind of invisibility at nighttime is that we ask outreach teams conducting the census to do shifts in the daytime as well. So when women are more visible, maybe in and around services, we ask teams to go and speak to them at those times as well. Because we know that women's patterns of rough sleeping are often different from men's, so they're more transient. Women are kind of moving around almost every night. So maybe one night on a bus, one night in a hospital waiting room, the next night in a stranger's flat, and more intermittent, meaning again that they're much less likely to show up in the rough sleeping snapshot counts, but also less likely to be found when outreach teams receive referrals for people experiencing rough sleeping. By the time they get there, the woman's probably had to move on. We responded to this by extending the data collection window to a period of 7 days, and also asking women about their experiences over the last 3 months. So not just saying, where did you sleep last night, but asking them about where they'd been over the last 3 months to really try and understand those patterns of rough sleeping, where women are going to, and how that's working for them. In response to the fact that we know that women are often not in contact with homelessness services, not in contact with outreach teams, as we saw from that film there, almost half of those women weren't in contact with homelessness services. However, they are likely to be popping up in other places across the system, so maybe health services, A&E departments, GP surgeries or substance misuse services. All these places might be seeing and supporting women experiencing rough sleeping, but we're not sharing that data between these different services and sectors. In response to that, in the census, we do bring those services together, we do bring those sectors together, and we share data across those services to develop a more kind of inclusive and representative picture of women known to be rough sleeping by all of those different kinds of services. And finally, just responding to the challenge that rough sleeping provision has predominantly been designed for how men experience rough sleeping, and the understanding of and recognition of women's experiences of rough sleeping has, thus far been fairly limited. So as I said earlier, the census goes beyond just going out and counting and talking about numbers. We've asked every single woman that participated in the rough sleeping census about how and when and where they're rough sleeping. And we've now got a really comprehensive body of data, 815 women across England telling us about their experiences. That's a really kind of compelling amount of evidence to kind of shape our approach on going forward. So I'm now going to hand over to my colleague, Ellie from Solace, who's going to be telling you a little bit more about what the census found in 2022.
Thanks very much, Lucy. I'm Eleanor, as Lucy says, from Solace. I'm just going to talk very briefly about what the census involves and how we first did it as well. So we designed and delivered the first census in London boroughs in 2022. That was the first time it was done, and we received 154 survey responses as part of that census from women who'd been experiencing rough sleeping. I'm not going to go through too much, but just to kind of briefly cover what we kind of learned from that first census. So we heard from women who were experiencing rough sleeping in a wide variety of places where they were unlikely to be seen by outreach workers. So you can see in this quote, kind of sleeping in woods, in buses, in hospitals, a real range of places, and that idea of having to hide for their safety as well. We also heard caseworkers and outreach teams reflect that current processes aren't supporting or allowing them to reach women effectively, and that changing the practice for the census made them realise that actually a lot of current practice doesn't allow them to reach women all year round. And importantly, the findings from the first report were that women's rough sleeping is hidden, transient and intermittent, and that current systems and processes used for establishing rough sleeping aren't fit for purpose, as they're predominantly designed for men who are rough sleeping. So these were really important findings, and what we got was really important evidence to back up what we'd previously not really had in data form before, but it had been known to services and practitioners anecdotally, and of course known to women who were experiencing this, that they were that step removed from services. So it was really important body of evidence to start collecting. It was the first time we delivered it in 2022, and we knew that we wanted to deliver it again to build upon that evidence, to practice it, and to learn from doing the census as well, in the actual act of going out and trying to find women and what we learned from that. And next slide, please. So what does the census actually involve? So in 2023, there were two components to the census. The first was the census survey, and that's conducted over a 7-day census period. It's a 10-question kind of fairly basic survey that's completed with women who've experienced rough sleeping over the last 3 months. And we use a specific gender-informed definition of rough sleeping for the purposes of the census. That census survey is conducted with women by outreach teams going out on gender-informed shifts that we provided guidance for. And it's also, as Lucy said, conducted by all sorts of different services. So perhaps day centres, accommodation services, as well as health services, violence against women and girls services, drug and alcohol teams, a real range of services trying to reach women in lots of different ways over that 7-day period. In 2023, we also introduced a new element to the census based on feedback and findings from the first census, and these are data meetings, and that involves local services coming together to submit numbers of women that they work with who they know to be rough sleeping according to the census gender-informed definition, to try and get those numbers in a different way and really understand who services are supporting across that same time period. Those services then also discuss the key challenges that they face in their local area in supporting women who are rough sleeping. So that might be challenges in terms of what accommodation is available, or what resources are available, or how they reach women, or particular difficulties that women face in that area as well. Next slide, please. So who took part? We delivered the census again in 2023 in the last week of September. And what we knew after we conducted the first census in 2022 is that these findings were very unlikely to apply to London only. That's not what kind of data and research that we have so far shows. So we knew that those findings were likely to be very relevant to elsewhere as well. So we're therefore really pleased to have support from a number of local authorities take part in 2023. And we're looking forward to hearing from some of those today. You can see they're listed here. We had Greater Manchester, Coventry, Leeds, Bournemouth, Christchurch and Poole, Nottinghamshire, Gloucestershire, Cambridge and Herefordshire, a real range of local authorities, as you can see on the map, across the country, and also really different types, different sizes, different makeups of kind of rural versus urban areas within those local authorities. Thank you so much for all of those local authorities for taking part and their dedication in making this happen in those areas. It's been fantastic to really expand the census and see how it can operate elsewhere as well and get all the data that we've had total. All those areas that took part completed the census survey, and some of those areas, so 17 of the London boroughs and 5 other local authorities, piloted and trialled those data meetings as part of the census as well this year. I'm now going to hand you over to Sam, who's done fantastic work with her colleague Katie in analysing all the census results and producing a fantastic report. And she's just going to cover some of the highlights from the report today as well. Thank you.
Thanks, Ellie. Yeah, so I'm Sam Wright, and I work for Change, Grow, Live, and I'd just like to say what a pleasure it's been working on this project with Ellie and Lucy and Izzy, and yeah, to repeat the huge thanks to all the outreach teams and other practitioners who implemented the survey, and also huge thanks to the women for sharing their information with those workers. And finally, a big thank you to Katie Hughes, who helped me write the report. Next slide, please. Yeah, let's skip to the next one. So, what did the census tell us, really? As Ellie said, you know, basically we identified many more women through the census than have been identified using other research methods. So these gender-informed approaches made a huge difference. This year, 41% local authorities participated in the work, and they identified 815 women. In London alone, the 27 London boroughs that took part, there were 391 women identified, and that was over double the numbers identified the previous year. So there's that kind of suggestion that we're finding more women as kind of local authorities take part year on year. In the data meetings, so those were held across 22 local authorities, a bigger pool again of women was identified. So 838 women were identified when practitioners from across different sectors came together and talked about the women that they knew were rough sleeping in their area. There were also an additional 212 women who were known to services, but there was insufficient detail to completely verify that they were rough sleeping. Next slide, please. So the Women's Rough Sleeping Census, every area returned greater numbers than other estimates. So this table compares the women's rough sleeping data on the right-hand side with the government rough sleeping snapshot on the left-hand side. And we can see that across every area, the Women's Rough Sleeping Census identified substantially larger numbers of women. The numbers, are maybe not that hugely important, despite the enormous amount of work that's been committed, because we know that there will still be yet more women that weren't reached and identified in our work. So it's the scale of disparity between existing numbers, the rough sleeping snapshot on the one hand, and the numbers of women identified when a gender-informed approach is taken. So if we look at Greater Manchester, for example, 5 women were identified in the 2023 rough sleeping snapshot, and that's across 10 local authorities. But in the gender-informed approach of the Women's Rough Sleeping Census, 188 women were identified across 8 local authorities. So a huge disparity in numbers. And if we just look at the sort of totals, the second to bottom row of numbers. So when we look at all the authorities that took part in the Women's Rough Sleeping Census, who identified the 815 women for us, if we look at their rough sleeping snapshot statistics, they found 189 women using those ungender-informed approaches. So in total, for England, we get 568 women identified by 317 local authorities using the government approach, whereas when we use gender-informed approaches, just within 41 local authorities, we find 815 women. Next slide, please. So just to kind of represent the scale of difference, I suppose, visually, if we look at this, this slide, the green bars are the rough sleeping snapshot data. The orange bars are the rough sleeping census survey, and then the blue bars are the data meeting, the numbers of women identified in the data meeting. So we see consistently substantially larger numbers when we use a gender-informed approach. And particularly within the data meetings, those identified the largest numbers of women in all but one site. So this really emphasises the value of multi-agency working, bringing frontline staff together to share information, and highlights how that really important frontline knowledge is ignored in existing methods of counting rough sleeping women. Next slide, please. So bringing the sort of data together, what do we kind of learn really? So the census and survey data itself suggests that on average, 17 rough sleeping women were found per local authority, a huge range from sort of 0 to 61. But when we compare that to the women identified through the data meetings, that really kind of mushrooms. So we're then talking about an average of 46 women per local authority. And for London alone, the numbers were an average of 41 women per London borough. Again, a big range, really, a range from sort of 7 to 135, partially determined by the scale of outreach and the scale of the count that was undertaken. But those London figures are almost double the chain estimates. And the numbers as a whole for England were 9 times larger. So we found 9 times as many women using the Women's Rough Sleeping Census than were identified in the 2023 Rough Sleeping Snapshot. So that's a huge discrepancy. And as we say in the report, this is a huge concern if commissioning decisions around provision for women who are rough sleeping are based on those hugely underestimated figures from either the Rough Sleeping Snapshot or chain data. Next slide, please. I mean, and the thing to bear in mind, I suppose, is that we're not claiming that the numbers that we have gathered through the research are the numbers of rough sleeping women. We know those are still underestimates. We know that the London boroughs that participated in the 2022 pilot and then in the 2023 census, they doubled the numbers of women found in that period. So, we anticipate that year on year, as we kind of refine the methods of identifying women, those numbers will increase substantially. And part of this is recognising where women are sleeping rough and being more creative about where to look for them. So this graph shows the variety of places where women say they are sleeping rough. So there are health and criminal justice settings, such as A&E waiting rooms. There's a range of temporary accommodation, refuges, hostels, bed and breakfast, night shelters. Women use personal networks, so they may stay with relatives or friends or strangers if they get offered somewhere safe and dry to stay. And then also public spaces. So that might be fast food venues, walking around all night, public transport network, or sleeping outside on the street. And what we know is that a number of these locations just aren't included in current government definitions of rough sleeping. So again, women are being excluded from counts. And that's why one of our key recommendations is about changing the definitions so that in counts and also in support provision, outreach teams can better recognise women who are rough sleeping. Next slide, please. So when we look at how often women are sleeping rough, we see that it's a common feature of their lives, but it's perhaps more intermittent than for their male counterparts. So the graphs on the right-hand side just show how many nights women slept rough in the last 3 months and when they last slept rough. And the key findings really in this is just under half slept rough the previous night to being interviewed for the survey, with an additional 22% who had slept rough in the previous 3 months. Over half of the women who'd slept rough had done so for more than a third of that previous 3 months. So it is a substantial amount of time that they are sleeping rough. And we need to remember, I think, the importance of understanding their personal safety needs, the huge impact that this has in terms of how they experience rough sleeping, and the impact that has on their capacity to be identified in rough sleeping counts, but also to receive support that they need. Next slide, please. So we had two kind of main themes, I think, when we brought together all of the data from the census survey, from the data meetings. Two main sort of themes emerged for us. The first one being about how current identification and verification methods exclude so many women who sleep rough. So similar to the 2022 London census, the 23 census reveals that women's experiences of rough sleeping tend to be hidden, transient, and intermittent, such that the locations and ways in which they sleep rough frequently fall outside of government definitions, which means that they're highly likely to be missed in current snapshot counts, and they are unlikely to be identified as rough sleeping, with the implications that that has for them in terms of not being able to access support from outreach teams. Next slide, please. And, we know, the 2022 Kerslake report already talks about verification methods and the verification requirements as a huge barrier to rough sleeping prevention. So this really ties in with our recommendations about taking a more inclusive and gender-informed approaches to this. The second theme that we have is around women's homelessness not being resolved by current approaches to supporting them. So we know that a significant number of women in the research talked about how they had been experiencing homelessness in another form prior to rough sleeping. A third of them had been in some form of homelessness accommodation beforehand, which again is of real concern to us, because it demonstrates that the accommodation that we provide to women, supposedly to resolve homelessness, is not doing that job. It's either not sustainable for them or it's not suitable for their needs, or both. So we end up with a situation where women are forced to return to rough sleeping rather than use current provision. And then many of the local authorities involved in the data meetings talked about how their local accommodation options weren't considered safe by women. They weren't specialist provision. They didn't respond to their specific needs, or they were unsuitable in other ways. They maybe didn't provide accommodation for couples, and women often feel a need to stay in a couple because that makes them safer on the streets. Okay, so that's a very brief run through the report, and I will hand over back to you, Sophie.
Thank you very much, Sam, Lucy and Eleanor. I think absolutely kind of huge amount of information there and incredibly insightful, and just fantastic to see and hear from you about the findings of the report. Next, we're going to hear from 3 of the local authorities who supported the Women's Census last year about their experience of delivering. So we're going to first be hearing from Gloucestershire County Council. We're going to be hearing from Caroline Lucas-Mowat and Sherry Keenan. They're going to be followed by Bournemouth, Christchurch and Poole, so Fraser Nicholson and Sarah Turner. And lastly, we're going to hear from Niamh Foley and Beth Kilheedy from Greater Manchester Combined Authority. Just before I hand over to Caroline and Sherry, I just want to remind everyone that we're going to be doing Q&A all together at the end. So if you have any questions for Sam, for Eleanor, for Lucy, or for any of our local authority speakers coming up, please just pop them in as we go, so we're ready to go when we get to the Q&A. Thank you. Caroline and Jerry, are you there just to speak up?
Hello, can you hear us?
We can, yes, there we are.
Perfect. Sorry. Thanks so much, Sophie. So I'm Caroline Lucas-Moat. I'm a programme manager with Gloucestershire Housing Partnership. So as a partnership team, we work strategically across our local authorities and statutory bodies within Gloucestershire. And our work focuses on ending rough sleeping, domestic abuse and international resettlement. So we became involved in the pilot in 2023 through our recognition of the gender gap in our responses to rough sleeping. So women were missing from our data, they were missing from our cohort discussions and our accommodation services. Yet our collective knowledge as practitioners, which is backed up by academic research, indicated that these women weren't in fact missing, but they were hidden. So women didn't fit neatly into our separate programme categories, such as rough sleeping or domestic abuse, but faced an intersection of homelessness and violence, amongst other forms of oppression. So we knew that women were not failing to engage with our services. Instead, our service design, our policy and practice often excluded them. So I became involved in Homeless Link's women's housing movement and subsequently the Women's Rough Sleeping Census to begin to address the gender bias that is inherent in all of our responses. So joining the census meant we were able to contribute to building an understanding locally of women's experiences, but also to contribute to the developing picture across the country. Taking part allowed us to benefit from the learning that had shaped the census in London in 2022, both in terms of the expertise from the practitioners, as well as all of the women with lived experience that contributed to developing the census. Gloucestershire, however, is a largely rural county, so we had some challenges to adapt this census to our kind of local conditions. We know that homelessness is hidden in rural areas. Women experiencing homelessness here may be disadvantaged, not just because of their gender, but the rurality of their location too. There were geographical challenges for our outreach services in locating women across swathes of rural Gloucestershire. So we had to roll out the census slightly differently to try to capture the needs in these areas as well as in our more urban settings. So strategic support and strong relationships with stakeholders were really key to us achieving delivering the census. Delivering the work from within the housing partnership meant that we did already have a good framework for achieving support from our housing authorities, as well as having really close working relationships with health. We had to provide reassurances to our stakeholders about where this approach sits. So kind of reassuring that it wasn't sitting in opposition to, but in addition to existing verification practices and existing snapshot data. So within our partnership, we commission our rough sleep outreach and accommodation services, and these are provided by P3 charity. So we were able to influence their involvement as a key stakeholder in delivering the census. We had a relatively short window of time to get agencies involved, but most really positively embraced the census and were really glad of the opportunity to shine a spotlight on the barriers that the women that they support kind of day in, day out face when homeless. So we wanted to start joining the dots between our rough sleeper and domestic abuse programmes. So we looked at strengthening our coordinated community response to ensure that the needs of women who are rough sleeping are appropriately understood, but also safeguarded. So to do this, we not only needed organisations that were working within homelessness specifically, but also specialists working in the violence against women and girls sector. So for example, our local domestic abuse support service, GDAS, as well as teams like our vulnerable access nursing team from sexual health. One of the really key partners to get on board to help us deliver the census was the Nelson Trust Women's Centre. So working with Nelson Trust was not only beneficial in that they already supported and knew many of the cohort of women experiencing rough sleeping, but gender-informed practices is really at the heart of what they do. So this gave us an opportunity to model in a really collaborative space, not only the why to be gender-informed, but the how. So we were able to demonstrate to operational colleagues in quite practical terms, not only where women may rough sleep, but also developing knowledge within the county about why women may distrust services. It gave us an opportunity to develop an understanding locally of the stigma that many women face, and hence the importance of non-judgmental and compassionate responses. The census also gave us an opportunity for us to ask women questions that they may have not been asked before. And we wanted to ensure that the census led to a change in our system. So we opted to include an extra question within our survey to gather specific information from women about what they wanted from accommodation services. And this is now being taken forward to inform commissioning work. More than anything, this work is helping us to ensure that as a system, we're not replicating the patterns of coercion and control that dominate many of these women's lives, but instead we're listening to women. We are empowering them through timely responses and appropriate accommodation that prioritizes their safety. I'm going to hand over to my colleague, Cherie Keenan, who's our domestic abuse and housing coordinator, and she's just going to talk through her involvement with the census last year.
Good morning, everyone. So as Caroline Lucas Mark said, my name is Cherie Keenan. Last year, when we first implemented the census in Gloucestershire, I was working as the service lead at the Nelson Trust Women's Centre. The Women's Centre is a safe, trauma-informed and gender-responsive environment which provides holistic support for women and their children. Their strengths-based model and collaborative approach views the women as a person first, not just someone with needs and risks, but someone with strengths, interests, personal experiences and goals. Each of the clients have their own key worker who works with them and co-creates a support plan to address their needs. This is achieved through one-to-one sessions, group work and access to specialist services. When we were initially asked to lead on the census, we felt privileged. It demonstrated that housing professionals valued the work that we were doing and the relationship that we had with the women. We attended planning meetings where we discussed the agenda for the census week. It felt very organised, and we had the opportunity to ask questions on things we were unsure around. The meeting prior to the census was well attended by a range of professionals. I relied really heavily on my colleagues at the Nelson Trust to carry out the surveys with the women. Initially, some staff was concerned about asking these questions to women with multiple and complex needs and the risk that they could re-traumatise them and therefore not fit into our ethos of trauma-informed practice. I was mindful of this towards the start of the week. However, as time progressed, we realised that in fact, the very opposite was true. The questions offered an opportunity for the women to discuss their experience of homelessness, therefore giving the women who are often marginalised a voice when frequently their voice is forgotten. We were less organised than we should have been for the data meeting. However, that was mainly due to not really knowing what was the expectation and the information that we needed to gather and share. I'm very grateful to my colleague who efficiently collected all the data together and attended the data meeting with me to ensure this was accurate. The Nelson Trust already deliver evening outreach sessions, so we combined the implementation of the census with this. We added additional outreach sessions during the week, and we used this time to work through the questionnaire with the women. Across the centre, key workers worked really hard to implement the census as part of their key worker sessions. We ensured that we reiterated that it was optional to participate. However, the uptake to participate and be involved was substantial. It was evident that the relationships that the key workers have with the women were instrumental to ensuring that the women felt empowered to participate in the census. The questions that were asked by the key workers were done so in a way that showed empathy to the situation Moreover, the women wanted to participate because they wanted their voice to be heard about this subject. Reflecting on the census, it was evident that the women who participated were clear on the additional risks that were associated with having nowhere safe to stay. They expressed exactly how unsafe they felt in supported accommodation in the county and shared their ideas around what could be improved with the situation for women experiencing homelessness. This included specific mentions around female-only spaces. Working in this role at the Nelson Trust, I was aware that we worked with many women who were experiencing homelessness. However, even I didn't realise the extent of the problems we were facing. I will hand back to Sophie now.
Thank you very much. I think we're going to jump straight on to hear from Bournemouth, Christchurch and Poole next.
Yeah, thanks, Sophie. I'm Fraser Nicholson from BCP Council, which is, as you can see, there's Bournemouth, Christchurch and Poole. So if you can have our first slide, please. Okay, thanks. So as just to sort of touch on there, I'll be speaking in terms of BCP Council specifically. My colleague on the call, Sarah Turner, was involved with the partnerships as well, and specifically works for St Mungo's. So you'll be hearing from her in a minute. And just a slight bit of background to BCP. If you don't know, Bournemouth, Christchurch and Poole, 3 coastal towns, distinct towns, but they form one largely urban area on the south coast in an otherwise rural county of Dorset. And the population is just over 400,000. So next slide, please. So a bit of background about why we got involved in the area. So you'll have heard Isabella earlier talking about the Rough Sleep Data Framework, and most of you will be aware of that now. Well, BCP were early adopters of that work, so we've been involved for a couple of years with it, which also means we got a lot of data early on. But one of the things that was really clear, and that data has been really helpful and really good, but as again has been touched on, it's based on verification. And as it also has been touched on, women are less likely to be verified if they're rough sleeping. And so that was part of the awareness around that data framework work. And we're keen to ensure the data is accurate, and also that we consider anyone likely to be missed due to barriers such as factors around verification. We were aware that women are at higher risk of not being found, but we were unsure to what extent this was the case in BCP. So it was a clear data gap. And around this time last year, when the initial census the report of the initial census London pilot launched last year, attended that and was very immediately keen to be involved, to recognise this was something that would help, and also some of the other early adopters at that time in the data framework were getting involved as well. Next slide, please. Also as well, in terms of the data gap, going back to that actually before I move on, looking at our rough sleeping street counts, it was quite obvious that there was a bit of an issue in terms of underrepresentation of women. In the previous 7 counts, of which there's been a range of total people seen of between 34 and a maximum of 64. The percentage of those that are identified as female ranged from 19 to 21, a maximum of 21, but the average was 15%, so really quite low, lower than felt right. And the maximum number that was seen in one count was 11, which also represented the highest percentage, but generally speaking, very low in comparison to the number of men that were getting seen. So moving on then to how we got involved in a bit more detail, we have a large homelessness partnership in BCP, a lot of different organisations involved with it. So the first thing that we did was we raised the profile of the work, sort of shared the learning, shared you know, the webinar from last year with our local partnership, indicated that we would like to be involved, and then, you know, got approval through our from Homelessness Partnership Board locally on moving forward with that. And then discussed it with Mungos, who deliver our outreach service in BCP as well. And then again, following some initial discussion with some of the other early adopter areas, we expressed interest in being involved in the census last autumn, and that led on to the planning meetings with, you know, the other partners we've heard from today. I'm going to now pass on to Sarah before I come back in a little bit. Sarah's going to talk a little bit about how the kind of implementation of this went in BCP.
Thank you, Fraser. Okay, so our process, we identified partners and key people who needed to be involved in delivering the census. It was important that everyone knew what they were doing, so we created a work plan which had clear actions and timelines. We set up regular meetings to ensure there was ongoing communication and dialogue with everyone, with a view to getting everyone talking about the census. I think all the partners that were involved, every meeting we went to for the 3 months leading up to when Census Week was, we were all talking about it. We were all saying, don't forget Census Week, explaining to people what it was about, so that there was a real insight and knowledge across the local area. We had an incentive when we had the £5 gift voucher for those women who completed the survey, but we also were really gifted with some essential items that we were able to put little gift bags together for the women, with some essential items such as a drink, some sweets, a little bit of chocolate, and some basic toiletries. We provided training to all of those who participated in delivering the census and carrying out the surveys, and provided ongoing support for everyone throughout the process. And that included the women that we spoke to as well. We also gained some insight from those women who we currently worked with lived experience, to gain some insight and identify key local areas to target where women might be rough sleeping or homeless. Next slide, please. So these are some of the key partners who were involved. So we had our We Are With You, which is our local drug and alcohol agency, Shelter. We reached out to Health, which includes Dorset Work and Women's Project and the Homeless Health Team. We had the Health Bus, who provides specialist healthcare service for those experiencing homelessness. We reached out to our faith-based organisations, St Mungo's, who deliver our outreach service, our day centres, so Roots to Roots and FaithWorks, and BCP Council. We had our housing colleagues, adult social care, antisocial behaviour officers, police were involved, community safety officers, and were a key and such an important factor to being able to cover the whole area to make sure that we targeted all the women who we had identified as rough sleeping or homeless. Next slide, please. So our achievements and successes: we conducted women-only outreach shifts daily throughout Census Week, 6 till 9 in the morning and 9 p.m. at night until 1 a.m. in the morning. We completed 59 surveys, 16 of which were duplicate surveys. And what we mean by that is that the women were seen twice throughout the week. But out of those 59 surveys, it was 43 individual women that we saw. We gained invaluable insight into patterns and behaviours of women who are homeless or experiencing rough sleeping through the conversations that we were able to have with these women, and what they felt was missing in terms of service provision across BCP. It was also an opportunity for us to encourage women to become involved in shaping future services by sharing their experiences. And we increased our knowledge and experience of the women currently experiencing homelessness in BCP. And I'll hand back to Fraser to finish the presentation.
Thanks, Sarah. Okay, and I'll just finish off then with talking about some of the outcomes and the future plans. So we were very keen to ensure that there would be some tangible outcomes in terms of locally that came out of this as well, and that we would act on the data. So the first thing that we did, more or less straight away, started in January, was that a weekly women's drop-in has been set up every Thursday evening, which is slowly growing and developing. We've used some RSI funding towards that, although it's been staffed really by a wide range of volunteers drawn from the group and the team that delivered the census. So they've been, I mean, it's fantastic really, the amount of commitment and time that's been offered, not just during the week of the census, but then thereafter, in helping to staff this drop-in every Thursday. The funding will go towards interventions that can be, provided to the women and will last us for the whole of this year. So it gives us some sustainability, and then we look to keep that going afterwards as well. There's an article that's linked there that I can share afterwards, but we're involved with Homewards. Some of you might have heard of Homewards through the Royal Foundation and BCP, and it's just an article that they put out on International Women's Day regarding this this work. And then finally, some planning, several women-only accommodation services, but that's been touched on, like Caroline mentioned that I think in the last session. But so we're looking at rolling out some women's only accommodation for the same reasons as has been touched on by others. And that includes a somewhere safe to stay. Someone's just asked what that means. Somewhere safe to stay is SSTS. We have a number of those services, which is really for off-the street accommodation, which we're seeking to replace temporary accommodation like B&B with more and more. So the next, we're either going to repurpose, or more likely the next SSTS service that comes online this year will be delivered as a women's only service, and as well as that, looking at longer term housing through our accommodation pathways as they get repurposed and reprocured. So there's that. Also, Isabella just finally mentioned the verification not being a barrier was in sort of the letter that was sent out in March. So that's been included in our ending rough sleeping plan. Those of you will have probably just completed them and submitted them as well. And sharing with our wider partnership, the really helpful gender informed toolkit that Homeless Link recently published. And that's it from us. Thank you. That's our contact details.
Brilliant. Thank you very much, Fraser and Sarah. We're now going to hear from Niamh and Beth from Greater Manchester.
Hi, Sophie. Thanks for the introduction. So we're just going to talk briefly about the Greater Manchester approach to conducting the Women's Rough Sleeping Census. If we could skip forward and the next slide again, if that's okay. So the Greater Manchester Combined Authority conducted the census last year for the first time, and we had 8 out of 10 of our councils participate, and we kind of operate a unique position as a combined authority in that we have no statutory responsibility for homelessness. However, homelessness and rough sleeping has still been identified as part of like the mayoral commitment and priority. Because of this, it means that we have time and capacity to focus on more evidence-led approaches and different ways of working in addressing homelessness and rough sleeping. We've previously been involved in the National Rough Sleeping Data Framework that Isabella mentioned at the start of the meeting. And I suppose involvement in the Women's Rough Sleeping Census seemed a natural next step from that piece of work, or something extra to also inform a greater understanding of rough sleeping experiences. So when it came to conducting the census as a combined authority, Greater Manchester Combined Authority took on more of a facilitator role, This allowed our local authorities to kind of like focus on frontline delivery and conducting the census, while we were working at a bit more of a strategic level, linking in with other areas that are working on women's multiple disadvantage, such as Changing Futures, and also our police and crime commissioner colleagues who are working on the gender-based violence strategy. While all this was going on, it also meant that we had our internal research function able to kind of take on the role of dissecting and analysing the data, which is another sort of burden relieved of the local authorities. I'm going to hand over to Beth quickly, who's going to talk us through some of our findings as well that we came across in Greater Manchester.
Thanks, Niamh. Thanks, that's great. So as Niamh mentioned, 8 out of our 10 local authorities in Greater Manchester were involved in the census last year, and our final count was 190 women identified to have been experiencing rough sleeping in the 3-month period leading up to the census being conducted. These were predominantly found in 2 of our local authority areas, Manchester and Rochdale, but we understand this to be a reflection of capacity to be involved in the work and also connections with local services. And so we're hoping this year when we conduct the census again to see a more proportionate split across our 10 local authority areas, as we recognise that'll be a true representation of women's experiences of rough sleeping. And something similar has been mentioned previously in today's meeting, but of the 190 women found to be experiencing rough sleeping over the 3 months, 75 women indicated they'd slept rough the previous night. When we compare this against the annual rough sleeper snapshot, that was only 11 women identified in the 2022 snapshot in Greater Manchester. Again, really just showing how inappropriate that method is for including this vulnerable cohort. If we could have the next slide, please. And in terms of who these 190 women are, so they were aged between 18 and 63 with an average age of 37. And this is really concerning when we know from other research and evidence that the average age of death for a homeless woman is 43 years old. 154 of these women were white British, and of those who stated other ethnicities, those were Black or Black British African, mixed other, mixed white and Black African. Again, this is concerning. We know that those from non-white backgrounds report experience of core homelessness at a higher rate than white British individuals. And 12% of all those identified were non-UK nationals. Almost half of these had indefinite leave to remain, with others having pre-settled status as well. And if we could have the next slide, please. So 2 of the most important questions to us that were asked in the survey in terms of our analysis were that of where have you stayed or slept in the last 3 months and which services you currently accessing support from. So for the question based on where have you stayed or slept in the last 3 months, you can see some of the most popular answers hopefully on the screen there. This question was really important to us because it allowed us to develop understanding into the locations where women were rough sleeping, so we can ensure that these are covered on outreach routes. It also allows us to understand areas and buildings that women are spending their nights in that wouldn't necessarily be counted in a rough sleep account because of that definition, but it allows outreach workers to still engage with these women and support them where possible. And it also highlights to us the services and institutions that women engaged with before or while sleeping rough, and so then we can work with these organisations to try and prevent further rough sleeping. And if I could have the next slide, please. And so this slide focuses on that question about which services you currently accessing support from. And again, you can see the split of the different answers we got here. This one was really important to us because again, it tells us the services that these women are engaged with and that they trust and have that sort of relationship built with. So there's plenty that we can learn from these sort of services who are working in the right way. It also highlights the absence of any support that we might expect to see, highlighting gaps in service provision. And if I could have the next slide as well, please. And so the way we conducted the analysis of the big data set was to conduct a segmentation analysis. So the idea here is to develop an understanding of sub-cohorts based on common characteristics or behaviours. And we segmented the full 190 based on answers to the question, where were you staying most recently before sleeping rough? And the different segments here were those who'd been in rented accommodation, those who were in homes that they owned or that belonged to their family or partner, those who'd been sofa surfing, those in transitional supported housing, those in temporary accommodation, refuges, other institutions, and those in other accommodation. We decided to segment based on this question as we recognise the insight that it offers in relation to the journey towards rough sleeping. And crucially, what we want to know more about is where we can introduce prevention at an earlier point to reduce rough sleeping overall for this cohort. But I'll pass back to Niamh to talk more about our next steps with this work.
Thanks, Beth. So yeah, just to kind of summarise and think about the next steps, I might not have time to talk through all of these points in detail, but essentially they can be summarised into 3 key themes or different areas of where we're looking to take this work. So firstly, thinking about like frontline and outreach efforts. So really taking on board that gender-informed outreach approach and changes to outreach shifts, as well as changing access to service and tailoring services to meet women's needs as they approach the front door. So for example, in Rochdale, one of the results of conducting the census has been to set up a number of women's bed spaces that are there for emergency provision that women can request intermittently as emergency accommodation. Secondly, I suppose you could look at sort of the partnership working of the census. So a large proportion of our census returns came from those partner organisations. I think there's a role there for Greater Manchester Combined Authority to really sort of help local authorities foster those relationships locally, but also utilise our networks such as the Greater Manchester Homelessness Action Network to really tap into those key services that know about these women that are usually sort of hidden to us. And thirdly, to say that we have a role here to push this conversation nationally, especially as we're part of the early adopter national data framework. And there's definitely some work to be done around lobbying and understanding that women need to be sort of counted when it comes to their experiences of rough sleeping. Finally, and it's not part of the slides, but I suppose as well, we're really looking forward to taking part in the census this year, and we're looking forward to sort of tailoring our approach as well as getting 10 of our combined authorities on board this time around, taking on board feedback from previous years and really adjusting our approach going forward too. Thank you.
Fantastic, thank you. And thank you to all of our local authority speakers there. I think a huge amount of really insightful and interesting reflections on the sort of delivery, implementation, and of course the sort of what changes have been made as a result. We're now going to hear back from Lucy and Eleanor, who are going to share some of the recommendations from the Women's Census report and next steps.
Thank you, Sophie. Next slide, please. So we're just going to talk briefly about the recommendations coming out of the report. We're going to talk about next steps and calls to action for everyone here as well. Next slide, please. So we've got a lot of recommendations coming out of the report because we've learned a lot through the census. So please do read the full report for the full set, and of course read the full report for the full set of findings and information about the census in 2023 as well. And please do use the recommendations to see what you might be able to do within your role in the service. But I'll just summarise kind of what we've covered in those recommendations and what we think is important to call for. So for central government, the report recommends that there are dedicated functions and resources and strategic focus on women's rough sleeping within the government rough sleeping department to make sure that strategies, policies, new definitions and all the guidance documents coming from the government are gender informed so that they meet the needs of women and are inclusive of women as well. It's really important to have that right from the top and top down to support everyone else kind of working towards ending homelessness and rough sleeping, to be able to make sure they're meeting the needs of women. And we can't end rough sleeping for everyone without making sure that we meet the needs of women as well. Central and local government, what we've highlighted is in the report is the need for cross-departmental strategies at government and a local level. I think everyone here can recognise that we cannot just solve women's rough sleeping and women's homelessness through the homelessness sector alone. Women have multiple needs that interact with lots of different sectors and services: women's services, health services, drug and alcohol services, social services, all sorts. And that's why we've had that engagement from lots of different sectors in the census. And we really need to approach that at a strategic level, bringing all those services together to create the best effect and best outcome for women experiencing rough sleeping. For local authorities and services, the report highlights the need for improved gender-informed practices so that services can better reach women and women can better reach and get in contact with services. That includes introducing gender-informed outreach practices, which are part of doing the census as well. That's a good way of introducing them through trialling through the census, as well as removing the need for verification of rough sleeping. And that kind of comes in at different levels. We need support from different levels to be able to achieve that. Also, women's specialist roles and a no wrong door approach so that, again, women can get the support that they need, specialist support that they need, and also approach lots of different services to be able to get in touch with homelessness services and not have to go through a specific route that they may not know about at first. For everyone, the report really highlights the need for urgent attendance on the safety and effectiveness of services, including accommodation, and that includes women-only accommodation as well. We were really struck from the census results this year, from what people who were responding to the census, from what women told us, from what services told us in their data meetings. Safety was a really striking factor in terms of what women experience when they go to accommodation services and other services, and that's really crucial in attending to services being gender informed. Safety is a really key part of that, and it's a really key part of why for many women they are having to leave accommodation, or why that they don't accept accommodation and continue to rough sleep. So this one's hugely important, and it's something that we really heard about in that video at the start as well. And for everyone as well, the report identifies the need for preventative solutions. The report tells us where women are rough sleeping, it tells us what their experiences are, but it also shows that there's a real gradual deterioration into rough sleeping for women, which is really concerning, but also means that there are opportunities for everyone to step in earlier for us to find preventative solutions at an earlier point to prevent women rough sleeping for longer, or to prevent women from rough sleeping at all. So there's work to do on that for everyone to uncover some of those solutions and really work on those, recognising that gradual deterioration. Next slide, please. So we've heard a little bit from the different local authorities who've spoken today, and we've heard so many good things from those local authorities about what's happening in their areas already as a result of the census in the month since. We've heard broadly that the census has improved understanding at a wide range of levels, service level as well as commissioning level and so on, and that it's really brought attention to this issue and helped them to put it on the agenda. But we've heard some really specific and tangible outcomes as well. We've got kind of pages of these outcomes, but I can just summarise a couple here. We've got different examples of accommodation for women that's been funded and approved and started in part due to having the data from the census back up the evidence, demonstrate evidence for the need for it. One area's had a shared house created for women in light of the census data and highlighting that need for it. We've had additional local funds in one area used to provide evening winter services. So really quickly after the census was delivered in September, being able to use that data to make sure there was winter provision for women. Results have been included in SHAP bids, so Single Homelessness Accommodation Project bids, and that's been approved at the first stage so far. There's been funding received through the Rough Sleeping Initiative to deliver a women's weekly drop-in in one area, directly building on the multi-agency work from the census in that area, which is already being delivered. There's been funding in another area received for an evening drop-in, and the project told us that they've been campaigning for the need for this project for a number of years, but getting the census data was one of the final things that helped them to get it over the line, again, backing up that evidence and showing the need for that service. And we've seen roles created for women's support workers in different teams as well. And what's not on here, but we've heard about the ability to develop new policy responses specifically as a response to the census data, the data being included in new homelessness strategies. We've heard about teams and outreach teams adopting the gender-informed definition of rough sleeping and adopting gender-informed practices and shifts already. So really tangible outcomes that have come out of doing the census, and that the data can provide and support these dedicated local authorities to enact and improve support in their local areas already just after first delivery and after only a couple of months. I'm going to pass back to Lucy, who's going to talk through what's next and our calls to action for everyone here as well. Thanks, Lucy.
Thanks, Ellie. So our calls to action today. So we are writing a letter to government in the next few weeks to reiterate these calls for action, and we'd love everyone here to sign that letter. We'll send out details of that. But really today we are calling on the government to change the way that women's rough sleeping is recognised, counted and responded to. And we've got 3 key asks within that. So firstly, we ask that the government make homelessness policies gender informed, and that's in recognition of everything that we've heard today. Current rough sleeping definitions and strategies and outreach practices have been based predominantly on the experiences of men's rough sleeping. We know that women aren't a minority group. You know, women are 50% of people in this country. We know that the pandemic has disproportionately impacted on women. Austerity has disproportionately impacted on women, and that women are disproportionately affected by violence and abuse. So it just doesn't add up that women make up such a small proportion of the rough sleeping population. The census data has proved that they don't. It's just that they're not visible and they're not recognised in policy, strategy and definition. We're calling upon the government to resource and lead on the women's rough sleeping census. It's been incredible what the census has been able to achieve this year, and hearing from so many local authorities about the collaboration, just the sheer amount of organisations and practitioners and services involved in making this happen is fantastic. But we really need to see government funding and government leadership brought together to resource this, so that all local authorities are able to participate in the rough sleeping census going forward in the same way as the snapshot count. And finally, we're asking government to conduct an equalities impact assessment on all data that's collected on rough sleeping, to really ensure that that data collection and those methods used are equitable, that they're not excluding women and further disadvantaging women, and also thinking within that as well about other groups that aren't served well by current practices. So we will be sending that letter out over the next few weeks, and please do sign it. The more voices we have, obviously the better. And the next slide, please. And finally, very quickly, we're short of time, but our calls of action to you today. And as it says there, let's continue this work to collaborate to end rough sleeping for women. There are so many ways to get involved in this really important work. So firstly, as I mentioned, encouraging your organisation or your local authority to sign our letter and kind of really build that collective voice, asking for tangible change to practice and policy in how we respond to women's rough sleeping. As we've mentioned, the census is taking place again this year, week beginning 23rd of September, so please do get involved. If your area isn't familiar with the census, we will be refining the kind of final methodology using the recommendations of the report that's being launched today, and packaging up some guidance and some other kind of support for local authorities who want to take part. So yeah, please join this movement, please do join this year and get a more accurate representation of how many women are rough sleeping in your area. And finally, as Ellie said, it's about reading the report itself. There are so many useful and helpful recommendations in there. So many women's voices and experiences are reflected in this piece of work. So whether you deliver services or design or fund or commission services, please do have a read and kind of consider how the findings of the census and the recommendations can help to kind of change and develop best practice and make sure that all of our services are as inclusive and responsive to women's rough sleeping as they possibly can be. We're just out of time, but I think we've got some time for Q&A, so I'm going to hand back to Sophie. Thank you.
Thank you very much, Lucy and Eleanor. We've got just shy of 15 minutes for some Q&A. I'm going to ask all of our panelists to turn your cameras back on, please. I'll do my best at directing questions, but there's a lot of you and you might have things to say, and please do sort of jump in if I haven't directed to you. And thank you to everyone in the audience who've been submitting questions as we've gone. First question, I'm gonna put to you, Eleanor, and perhaps Lucy as well. So there's a question in the chat around the challenges of comparison with different methods of counting that already exist. So the sort of snapshot, the comparison was used in the presentation with the snapshot because it publishes by gender, but we also have the ending rough sleeping dashboard, which has a figure for rough sleeping that's maybe a bit more comparative because it captures over a longer period than a single night. And that shows a much greater number than the rough sleeping snapshot. Have you considered, the question in the chat is, have you considered the extent that some of the differences between the snapshot figure and the census could be due to a single night compared with a longer period of time? And how do we account for those differences when we're looking at, proportions of people, or sort of really truly understanding the narrative around the numbers of women rough sleeping and how that reflects to what we already know?
I can take that one, but anyone please jump in. Yeah, I think it's really important to say that we haven't produced a census as a kind of direct comparator to the rough sleeping snapshot, but that is the best data that we currently have to be able to compare to. And what's really important is that the rough sleeping snapshot is not supposed to see everyone who's rough sleeping, but it's partly the way it's used as well. And that's why it's important to demonstrate the vast discrepancy. And it's the question, I think, mentioned that because the snapshot's delivered over captures a single night, and we expand the census period over 7 days, and we also talk about women who've rough slept in the last 3 months. And that's very deliberate because we think we will see more women that way. I think it's really important to highlight that I think it's 125 of the local authorities taking part in the rough sleeping snapshot in 2023, so 0 women. And that doesn't tell us anything particularly useful. We know that it's highly unlikely that there are going to be absolutely no women rough sleeping in those areas. So while the snapshot is a really useful tool to be able to provide exactly that, a snapshot, it doesn't demonstrate what's happening for women effectively. And that's why we've expanded the length of time in the census so that we can better represent what's happening for women and find out more about it. So they're not intended to be direct comparisons. We want to be able to gather more data in the census, and that's what we've done. But it's really useful to be able to show those stark discrepancies, to show actually women are out there. Often we do get local authorities saying we don't have any women rough sleeping in our area, and we know that's just not the case. So it's really important to have this better data to demonstrate that the scale of women's rough sleeping is much bigger than what we currently understand, I think.
Can I come in as well on that? I think, because I mentioned the data framework that we've been working on, and it's obviously now been rolled out nationally. Because we've got early adopters, quite a lot of about 18 months worth of data. And what that does is it's not just a snapshot, so it's monthly, gathering monthly cumulative data, so how many people were seen in an entire month, and then a breakdown of that, as well as a single night figure per month, as well as the snapshot still happening once a year. And that shows very similar trends. So I think what the census showed was that there is definitely large numbers of women that are getting missed, even when you factor in who was seen over an entire month, and that would be a consistent thing.
Brilliant, thank you both. And actually, sort of a question that follows on from some of those reflections, which is around other vulnerable groups who may be less likely to be visible. So young people, people of color, LGBTQ people with irregular immigration status. What do you think kind of the lessons learned from the women's census and the approach means for sort of rolling this kind of inclusive models out to different populations? And a sort of an addition to that from me is how do we do that in a way that sort of works together rather than just sort of suddenly becomes an awful lot of counting and not, that maybe overtakes the sort of the doing and the supporting, and how do we consider that? I mean, if there's anyone from local authorities and sort of reflections from your delivering around that, but also I don't know, Ellie, Lucy, if you want to come in on that as well.
I'm happy to start and then someone else please come in. Yeah, I think it's a really good point. And I think it's often the case that if you start looking at one group and how something isn't serving them, then you also kind of see other groups who are disadvantaged by a particular system or way of doing things. And that's certainly the case for all of the groups that you mentioned, all likely to be more hidden, transient and intermittent in their rough sleeping than heterosexual males who rough sleep, for example. So I think there's some really important learning that can be done around access to those groups. But I think it's also important to your point about, well, this just involved kind of lots and lots of different counting. And actually that's only kind of partially what the census is about. A lot of this is around learning and practice change all year round, actually, and how we can be using a cross-sector approach and kind of combine data sets to understand people experiencing multiple disadvantage effectively, and looking at different groups within that through work that's already been done and data that's already been collected but not necessarily being brought together. So I think, yeah, that's how I'd kind of start the answer to that question. It can absolutely inform our learning about how to reach other hard to reach groups, and also our call to government to look at data collection with equality as a kind of a framework, and kind of assessing how equitable these practices are is really important, not just for women but for other groups that have been disadvantaged by current systems as well. And I don't know whether anyone else wants to chip in on that.
I'm happy to.
If you like. Go on, Caroline. I spoke already.
I was just going to say, I think the Women's Census gives us a good platform to start thinking a bit more outside the box, and having a much more flexible approach to the kind of nuanced needs of different groups. But I think what's really important in the kind of gender-informed approach is actually this recognition of the role of violence for the women, and I kind of don't want to lose sight of that focus, because it's such a strong theme. I'm sure you'll find in the report that it's the strongest theme that kind of comes out from the women, that not only are they negotiating the fact that they haven't got a roof over their heads, actually they are managing their personal safety kind of minute by minute whilst they're experiencing homelessness. And so whilst it gives us this opportunity to kind of look at how we can be more flexible and consider how inclusive our practices are across the board, actually the focus on violence and women's safety is a really key kind of consideration with this approach. Not to say that that doesn't apply to other groups, but it's, there is this particular gender dynamic that's really central to the Women's Census.
Thanks. Thank you very much. Fraser, did you want to add anything?
Yeah, just that, I mean, I totally agree. And I think, obviously, there's different groups that are disproportionately at risk, or are hidden, or both. And it's something we have been looking at in BCP. We do have, we're trying to sort of tackle it in different phases, if you like. So at the moment, we've got a group that's working across agencies and services across the sector, around the LGBTQ+ community and the disproportionate risk to homelessness, more, not just rough sleeping, but homelessness more generally as well, with that group. But there's been discussions around different minority groups and how that needs to be tackled. Certainly, some of the similar themes that we've been talking about today would apply.
Great, thank you. We've had a couple of questions in the group that are sort of asking about demographics and what we maybe learn about what those demographics tell us about sort of whether people are particularly at risk, what it might tell us about where prevention efforts could be focused. So particularly a few questions around, did it help us identify where people were prior to becoming homelessness, whether we saw overrepresentation of people, prison leavers, people leaving the asylum system, you know, care leavers. So just any kind of reflections on that. Sam, was there anything from the analysis that people can look forward to in the full report? And I'm thinking kind of that there's a yes to this, because obviously we've just seen Beth, your kind of breakdown that you looked at Greater Manchester. So were there any kind of additional reflections on that from your perspective?
Yeah, I mean, we know in terms of the write-up of the data that there were sort of 3% of the women who took part in the survey had exited prison onto the street. And similarly, 3% of the women had been in asylum accommodation at some point previously. We don't know more than that, and we haven't got any data on care leavers, unfortunately. But so yeah, we know it exists. But I don't know if anyone, especially from a sort of practice background, can kind of comment on maybe what kind of data questions would help us kind of build a useful picture in terms of developing practice.
Does anyone? Oh, sorry.
I think I can speak to a couple of the points as well. Yeah, there's a lot in the report, and there's so much data that we got back. Some things that we just can't necessarily, the census isn't necessarily an effective or accurate platform to ask particular questions, get different data, but there's certainly things that we want to explore further. I think any good data set or any good research like this, it means that you want to ask more questions. There are always more questions that you want to explore afterwards, and you can't learn everything. But for example, in demographics, we saw an overrepresentation of Black ethnic groups, particularly compared to the general population. But we also saw an underrepresentation of Asian ethnic groups compared to the general population. And things like that are coming through clearly. Some of those aren't surprising. We know that there are particular groups who are more susceptible to homelessness due to racial disparities and racial discrimination and so on. So that's really important for us to kind of think about and reflect on and move on further, as well as with all data collection, kind of what is it telling us and what is it still not telling us? What do we want to find out more? It's also, of course, really important since we've done the census. A lot of things have happened with practices of asylum evictions from asylum accommodation. So that's something that's really important to consider, as that constantly changes. While we don't have accurate information about people's status who answered the survey, because that's quite a sensitive and difficult thing to ask of women, it's really important for women to feel confident in the questions that they're answering and that they're not going to be targeted as a result of anything. But something that we should consider. And I've forgotten the main point that I was going to say there. I'm really sorry.
Can I just say that I suppose it's the combination of the survey and the data meetings as well, isn't there? There's a lot of untapped practitioner knowledge, so that maybe we could have some in the future, some structured discussions about some of these demographics to sort of pull out practitioner insight on those.
That's really reminded me, Sam. Yeah, what we did get is through the data meetings services kind of reflecting that there's no safe pathway for women who are without recourse and who have nowhere to go. And the safe pathways for women who do have recourse are very difficult in themselves and they don't work effectively, but it's so minimal for women who are fleeing violence and who don't have that no recourse. That came through very strongly through the data meetings.
And just to add to this sort of like broad discussion as well, thinking about demographics and especially like those women that have been part of asylum accommodation, Greater Manchester being sort of, I suppose, an attractive area for people who are seeking asylum, and we're seeing a real increase in the number of people being evicted from circle accommodation and those speed up of asylum decisions. We're really fortunate in Greater Manchester that alongside our homelessness team, we also have an asylum and immigration team who are really working on those issues. And it's definitely something that we'd like to bring into the census this year and a real like focus on it. I think one of the barriers last year as well was around sort of the lack of translation in the survey. So that's something that we're looking to really improve upon, because that really shows that we've missed possibly like a whole cohort of people there too.
Thank you. I think we've probably got time for one last very quick question. And I know some of this is touched on in the recommendations of the main report that Eleanor and Lucy were just covering. But there's a question around, is it time to sort of get rid of the idea of verifying in favour of more effective ways of supporting rough sleepers? I guess this is a question to the local authorities who took part. Has your learning from the census, has it led to you changing your kind of approach and policy to verification to access support? Who wants to go first?
So mind. Oh, sorry. It's okay, Caroline, go ahead, sorry.
So we're currently working on proposals. So I'm going to talk kind of hypothetically because they've not, it's not all signed and sealed yet. But so Nelson Trust were a key partner in delivering the census. They know a lot of the cohort already. So we're working with them to look at how we could use their practitioner knowledge to ensure that women can access our rough sleeper pathways without needing to be verified as bedded down. So we're looking at that as an alternative route through to our rough sleeper pathways, because we know that those women just don't, because they're not captured by our kind of outreach team at the moment. And the service already has that knowledge of those women's circumstances. The women trust the professionals working in that organisation to be kind of honest about what they're experiencing. So we're hoping to kind of capitalise on those relationships to be able to remove those barriers.
Brilliant, thank you. Fraser, very quickly because I'm mindful of time, and then Neve.
Okay. I'll be very quick because I did touch on it, I think, in the presentation anyway, but it's on our ending rough sleeping plan, the reference to that, certainly to look at that, and that would include all people, not just women, but would include women certainly within that.
Brilliant, thank you.
Yeah, just quickly from myself as well to say, and again, I think I touched on it in the presentation, that feedback from our local authorities is that they're looking to sort of incorporate the gender-informed practice in terms of like outreach and verification of rough sleeping, as well as sort of tailoring services to break down those barriers that we've mentioned too.
Brilliant, thank you. And feels like, you know, leaving there on a positive and seeing the kind of progress that can be made and how important this work is and how it is leading to sort of direct change that will hopefully massively improve the support of women experiencing homelessness. I will bring us to a close there. Sorry we didn't get to all the questions. But thank you for everyone who has attended and been here and been participating in the chat. A huge thank you to all the speakers. So Isabella, Eleanor, Lucy, Sam, Caroline, Cherie, Fraser, Sarah, Neve and Beth. Thank you for all of your input this morning. It's been incredibly interesting and really, you know, positive and well received. And please look out for the report, which I think a link might have just been dropped in the chat, that it is officially launched, which is fantastic. I'm sure everybody's looking forward to rushing off to read that immediately after this. But it'll also be circulated in your inbox, and I believe the slides will be as well. So also look back for that for information about how to get involved in taking part in the future Women's Census. Thank you very much, everybody.
Thank you.